Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. Now we want to be thinking about the treatment options. Now, just remember, it may be that you're thinking about the treatment option and then you also want to consult somebody else for second opinion. That's completely okay, and to change your mind. It's for you to decide what's best for you. Right? I'm here to give you food for thought, so you can be educated and aware and make the decisions that are best for you. Ask the questions that may help you with making those decisions. So standard treatment is the conventional treatment that is provided based on your cancer, based on the stage, based on your health, based on what protocols and things have worked. Okay. We went through chemotherapy, radiation, surgery. So depending on your particular cancer, you could be receiving one or a combination of these different treatments. Sometimes you may even be receiving chemotherapy and immunotherapy at the same time, or one after the other. So your treatment plan could consist of one or more treatments that are combined together. These are the different types of treatments: surgery, radiation, chemo, immune, targeted therapy, hormone therapy, stem cell transplant, bone marrow transplant, and there are always new ones coming up. Now, the questions you'll want to think about for your treatment when you meet with your team and they offer a treatment plan for you is you'll want to think about and look up what is the standard treatment for my type of cancer and my stage. Is this the only option? Are there other options? So you want to get a little bit familiar with it so you can understand why this particular treatment was decided for you and you feel comfortable about it. Also, you'll want to figure out what are the risks and benefits of these treatments. So as in, if we are given this treatment, what are the chances of this treatment helping with addressing my cancer? Is this a curative treatment, or is this a treatment for maintaining the pain or just keeping the tumor mass stable? So you'll want to understand, is it curative treatment? Is it palliative treatment? Is this a treatment that you need to take for the rest of your life? So you'll want to understand those kind of things about your treatment. When does the treatment need to start? And how often will you need to take that treatment? Is this the treatment that will be given to you where you come to the outpatient center and get your treatment and go home the same day? Or is it something that you need to be in the hospital? Or is it something that you are given the treatment and then it's like oral chemotherapy, you're taking it at home on your own and you're coming back for a visit? Those are the kind of things you'll want to find out. You'll want to understand chances of recovery, as in, is this first line treatment? Is this second line treatment? What is the goal of the treatment? So if it's successful, then what is the outcome we can expect from this treatment? Is there any data on this? Generally, they'll be able to provide you with some links and information on this. How do you know if the treatment is working? So for example, is it that, you'll see your CA-125 marker is improving, or is it something else? So how do those lab values connect to your outcomes? So how are we seeing that that the treatment is working, we are accomplishing the outcome? So those are some things that you may want to figure out. I think we have some more education and videos about these different labs and biomarkers as well for understanding whether the treatment is working or not. So you can go check out that video. You'll want to understand that, because then yes, okay, the treatment is working, or it's a little slower than what's expected, or if it's not, then is that why the treatment regimen or the plan is being changed or something is added on. So those are some things that will help you. Also, of course, you'll want to understand what are the risks and benefit with this treatment. That's a really important point I want to stress on. And that's because I think there are I see both sides to it. I see that sometimes we're just thinking about, okay, this will really help me, and we are going to get that treatment, but we haven't thought through um, the side effects that are going to be involved with this, and prepared for that well enough. So how physically debilitating it could be, or emotionally, or the fact that you might not have energy, or taking time off from work. So again, we are doing this treatment because it's going to help us with managing that cancer, with hopefully getting rid of that cancer. But we also need to be prepared for what are the side effects associated with it. Because when we are prepared, then we can have better outcomes. So we are not thrown off, right? So important to keep that in mind. At the same time, it's don't let it freak you out. Don't let it scare you so much that you're choosing to not go for your treatment. We take care of so many patients, at least in my profession. We are taking care of so many patients every single day. Hundreds and hundreds of patients per week are passing through our center, and they are all going through the treatment, and they're hanging in, and they're doing okay. So uh, sometimes fear of unknown can be overwhelming. So talk to somebody about it. Think about what is it that you're afraid of. Talk to someone about it. Sometimes our fears are bigger than the the actual issues. um, okay, so talk through it with somebody, and make a plan, so that you're not letting your fear affect your chances of survival, the best outcomes that you can get. All right. So do think about the side effects and the risk associated with your treatment. Here is some more questions going deeper into it. So for a specific treatment, once that's decided, like you're going to get chemotherapy or you're getting radiation, so you can ask, okay, what is the goal of this treatment? Where am I going to go for it? It's good to know what is the site for the treatment. Even if it's at the same center, it might be in a different building or a different floor. So on the day of the treatment, you don't want to be nervous, or feeling anxious about where the site is. So you can find out information about where it is. How do you get there? How long is the treatment when you actually are going for your treatment? So for example, you're going for a chemotherapy infusion. So how long should you expect to be there? So for example, when you're going for your chemo, we would be doing some lab tests for you. Then there is some wait time. Then you're seeing your doctor. Based on the values, they're determining if you're going to be getting treatment or not. Then you're going to the infusion center. There is some wait time there. And then you're getting the actual treatment. And there could be more than one chemo. There could be a combination of 2 or 3 chemo. So you would be there for some time. And then there is a wait time sometimes between the first and the second chemo. So it could be that you are there all day. So it's important to find out how long each session is going to last, so you are aware of it and you can come in prepared. So how many sessions you're going to have, and should you bring somebody with you for these sessions? Before COVID, we used to generally recommend for everyone to bring someone with them for the sessions. Now, since COVID, things have changed. So if you're watching this during active COVID time, check with your center about what are the rules around having somebody with you. And if you're not bringing somebody with you, then what are the arrangements you need to make? Do you need to have somebody who's going to pick you up, or can you take a Uber or Lyft or whatever, some kind of cab service? So for each treatment, you'll want to think about it. So for side effects, you'll want to look up online on reliable websites where I've provided those links for you. So you can look up for your particular treatment, what are the side effects. We have a session on going through the different types of treatments and the side effects associated with it. So if you've done that one, then you would have mapped out your side effects, right? So you'll know what are the side effects associated with your treatment. How long are those side effects supposed to last? Do they tend to be intense? Do they tend to be not so intense? how long are they intense for, and what are some of the long-term side effects. So long-term side effects are ones that may persist even after your treatment is done, sometimes for a few months, sometimes for several years. So you'll want to look up about the long-term side effects and what are the potential risks and emergencies that are associated with this. So again, you want to know what those could be. So if you are experiencing those symptoms, you can immediately take action and get help right away, right? And if you have kids around you, then how can this treatment affect the people around you? What are the precautions you need to take? So for example, if you're taking oral chemotherapy and you have the medication at home, then where do you need to store it? How do you protect your kids? Things like that. Or if you're getting some active treatment, flushing the toilet, those kind of things, where there could be potential exposure to others for chemotherapy, or other treatments, you'll want to find out about that. Now, second opinion. So here I want to share with you, it's completely okay and normal to get second opinion. All right. So when we're going through such a life-threatening disease, and there is so much confusion, so many different opinions, you may feel like you want to get a second opinion or third opinion before you feel comfortable and confident about it. Sometimes I hear people say, well, if I do that, will my provider be upset? Will they get angry? Will they think I don't trust them? That's generally not the case. All of us are professionals. It's very common. It's very normal. It's completely okay to get second opinion if you feel like you need it. You don't have to. If you're comfortable with the plan, if you're comfortable with the team, you feel ready to get started, then go for it. But if you feel like you want to talk to somebody else, you want to get opinion from someone else before you start the treatment, completely fine to do that. You can look up different sites where you can call the centers around you. We covered that in the other presentation about the different cancer centers that are around you that are accredited. You can go check those out and see the different providers there and get second opinion. We also have a list of the different centers and providers, so you can find that information in our resources and sites as well. So hopefully all these will help you in getting comfortable about your treatment and your plan of action that your provider is doing for you, and how you can think about it, how you can plan for it. And if you need to you can get second opinion so that you're ready for what is the treatment that is being planned for you and you're on board for it. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.